Now, certainly, y'all are living with some very unique challenges, given that you have ICDs. You know, you may know other people who have stents or who have had other type, you know, they've had a catheterization surgery, or they may even have other implanted devices, insulin pumps, things like that. What's unique about a cardiac device is that, as you know, it has the ability to shock your heart back into rhythm if it gets into one of those dangerous arrhythmias. And that's often the hardest thing to kind of accept and to get used to that thought, because you guys don't have much say over whether or not that happens, right? You know, you don't push a button to shock yourself. You know that it could happen, and if it does, it's going to be to save your life, and it's going to be a good event. But certainly, you know, it's reasonable to say that can feel kind of scary. Other adjustment issues that ICD patients report having, you know, concerns about driving, whether driving is safe. And this really is dependent on what your physician tells you. Sometimes your driving may be restricted, which is difficult for a lot of people to accept because it takes away some of your independence, takes away some of your control. But driving, if your physician tells you it's okay, we want you to feel safe doing that. I always tell people, you know, use common sense when you're driving. Be prepared for what you're going to do if you do get shocked. I get asked a lot, well, what if I get shocked while I'm driving? And my first response is, well, if you go into a life-threatening arrhythmia while you're driving, first of all, you are much safer having your ICD than you would be without it. Because without it, you would certainly lose consciousness pretty quickly. And then you're going to be dangerous to everybody on the road. With an ICD, even if you do get a shock, most likely you would maintain consciousness and be able to still control your vehicle and pull over to the side of the road. Obviously, we don't want you to keep driving, but you should be safe enough to get off the road. In fact, ICD patients are safer drivers than the general population. So remember that. You'll have fewer accidents than the rest of us idiots out there. So. Fear of exertion is another concern for a lot of patients. Again, you know, knowing that that device is there to shock your heart if it gets into a dangerous rhythm, some people assume that means, well, if I get my heart rate up at all, I'm going to get a shock. And that's not true. Your device is designed to let you get your heart rate up in a healthy way. If you want to, you know, exercise, do moderate exercise, whatever your doctor has told you is okay, we want you to be able to do all of that stuff. But there's a big difference between a dangerous fast rhythm and a normal fast rhythm. And your device is smart enough to tell the difference. Other things patients are often concerned about, sexual issues, stress management, which we talked about, doing stuff around the house. You know, all of these things are things that really are safe. A lot of patients want to know, is sex okay? Yes, it is. They've actually extensively studied sex and what happens in your body during sex. I don't know who volunteered to be in these studies, but some people did. And they took all these, we did. So they took all these vital signs in patients during sex. And you know what they found is what happens in your body during sex is very similar to what happens during very moderate exercise. So if your doctor gives you the okay, it's a safe activity. And it's also important to note, if on the off chance you did get a shock during sex, it's not going to harm your partners. You know, you're not going to hurt them in any way. That's usually what people want to know. So those are some potential adjustment issues. Now, just a quick review. Y'all probably all know this, but sometimes patients want to know, what exactly is my device doing? Do I have a pacemaker? Do I have an ICD? What's the difference? And when I say ICD, I mean defibrillator. Those two words are interchangeable. So every ICD has a pacemaker built in. So if you have an ICD, you kind of got a 2-for-1 deal. You've got a pacemaker in there too, and the pacemaker will keep your heart rate from getting too slow. The ICD is what can deliver the shock if you need it to terminate one of those life-threatening arrhythmias. And it's basically a really, really smart computer that just continuously monitors your heart, stores tons of information. If you ever have a fast rhythm, it'll store a picture of it. This is an example of what you know, a device might look like. You know, if you had a fast rate on July 11th, it would say what time. what it called the rhythm, how fast it was, maybe it stored a tracing of it. So anytime you have your device checked or you transmit it to the office, they can look at all this information and just keep really close tabs on what's going on with your heart. So hopefully that makes you feel very safe. I mean, this thing is watching your heart beat to beat 24 hours a day. And it also is designed to do a lot other than shock. You know, some patients think, well, it's just sitting there waiting to shock me at any moment, and that's not true. We want it to shock your heart if necessary, but it can also deliver pacing, which is painless therapy. Sometimes the device can do that to terminate one of those fast rhythms. So for a lot of you, that's our first choice of therapy. You know, if we can avoid shocking you, if we can pace you out of that fast rhythm, then a lot of times that's the best option, because we want the device to deliver a shock if it has to, but for a lot of patients, you can have that painless therapy. Has anybody been told that? Like, well, you had a couple of episodes that the device paced you out of it? Sometimes you know, the nurses might will tell you that, and most of the time you wouldn't even know that that had happened because you don't even feel that happening. So, but certainly it's there to deliver a shock if you need it for one of those lethal arrhythmias. Now, I talked earlier about how one thing that feels scary for patients about shock is that you're not in control of it. You're not deciding if and when it happens. And one way to sort of gain back some of that control is to at least be prepared for it, to make a plan for what you're going to do if you do get a shock. And it's really important to know, talk to Frankie or your device nurses or your doctor about what they want you to do if you do get a shock. And their instructions may be different depending, if you get one shock and you feel completely fine, they may just tell you, well, call us, we'll schedule you to come in, or we'll have you send a transmission from your house because we want to check the device, but it may not be an emergent situation. But if you get more than one shock, or you're just really not feeling right and you've been shocked, that's a more emergent situation that they want you to be ready to call 911 or go to the emergency room. Now, I always tell patients that think about in different scenarios what that would feel like. What if that happened? I had a patient once who his grandkids were spending the night, and he got shocked in the middle of the night and really wasn't feeling well, so he had to go to the emergency room. And the thing that stressed him out more than anything was, what are the grandkids going to do? Who can I call at this hour to come stay at my house? I don't want to wake them up and take them to the ER. I needed to have someone on standby that I knew I could call at any hour to help me out. And if he had already identified that person and he just knew that's who I'm calling, they know I might be calling them in the middle of the night, then he would have felt a little more relaxed about it. And so I encourage you to think about that and to talk to your family about that. Make those plans. If you want to write them down and post it on the refrigerator so that everybody knows if that happens, here's what we're going to do. We know what we're going to do. Always have your device ID card with you that tells us what kind of device you have, what kind of wires you have implanted. Anybody who checks your device may want that information. So that's important to have along with your list of medicines. So those kind of things, just the little details you may not always think about. And the goal of doing that is to, again, make you feel more prepared for that situation that might feel kind of scary because you're not in control of it necessarily. Does that make sense? Mm-hmm. Okay. So I said at the beginning that about 30 to 40% of patients say at some point I had some anxiety. And one of the things anxiety can cause is what we call avoidance behaviors, where patients start avoiding things that they either associate with shock or that they're just scared to do now, even if they've never been shocked. So, for example, I have a patient who got shocked while he was taking a shower. So, guess what? He doesn't do it.
Oh, no.
His wife told me, I told him he has to get his butt in the bathtub because he will take a bath, but he will not go in the shower. And he, he's afraid of it. He associates it with that shock experience. I have another patient who got shocked a few times in Walmart in Hickory, North Carolina, which is right by where I live. And so she now drives 15 miles to Statesville to go to that Walmart because this Walmart scares her. And she, she's a smart lady, and I tease her about it because she knows nothing in that Walmart caused her to get shocked. But device does, but I can control which Walmart I go to, and I'm going down the road to Statesville because I feel better there. I said, okay. But that's what we call avoidance behaviors, and it's a normal reaction. I mean, I think if that happened to me, I'd be scared of that Walmart too. But you want to keep an eye out for avoidance behaviors, because if you start avoiding things, particularly things you really enjoy, your quality of life is going to suffer. You know, you're going to be limiting what you're willing to do day to day, and we don't want that. If you get shocked doing a certain activity, when your device is checked, they may say, what were you doing when you got shocked? And that's not to imply that you caused the shock or that that activity was bad. But they just want to kind of put the pieces of the puzzle together and figure out, well, how can we make it so this isn't going to happen again? Let's make sure you weren't doing any activity you weren't supposed to be doing. And as long as that's the case, you should feel safe doing that activity again. Because in most cases, it wasn't what you were doing at the time that caused the shock. So just something to keep an eye out for. Another thing to look out for is these symptoms of depression. So I mentioned about a third of patients say they had some periods of depression, and depression can complicate recovery. There's a lot of research, and particularly from heart disease, depression can really complicate recovery. So I wanted to just mention some of these symptoms of depression, because some of them are obvious and some are much more subtle. And these can occur in the patient as well as family members. So it's important to have an awareness. Obviously, depressed mood, crying a lot, feelings of hopelessness, any kind of thoughts of harming yourself or suicide, certainly definitely let your physician or a trusted nurse or somebody know about that, because depression is a very, very treatable thing, and you don't have to feel that way. That's not part of living with an ICD that you just have to accept. We don't want you feeling that way. You can absolutely get over that hurdle. Some of the more subtle symptoms are things like sleep problems, appetite changes, trouble concentrating. So I just wanted to mention those because, again, it's a very common symptom. You are not alone if you have any of those feelings, and it's certainly safe to let somebody you trust know about it, because again, it's very, very treatable.